Hi, this is Dr. Alemi with the solution to the benchmarking exercise. In the exercise, we are asked to compare Dr. Smith and Dr. Jones, and we are provided with the attached data. Just to introduce some terminology, this entire section here is called the decision tree. A decision tree has some outcomes as well as some events. On the left, it starts with a node at start of the tree, and then thereafter the various events happen with different probabilities here. For example, 15% chance of congestive heart failure. And then the outcome is that the patient stayed 4.5 days. This part of a decision tree is called an event tree. A branch in a tree is a series of nodes starting from the root going all the way to the outcomes. This is the length of stay, for example 4.5 days. The probabilities are given on each arc, so there is 15% chance of it having congestive heart failure. The arc is the line between the two nodes, and the nodes is the small circles. Even though we only give one probability, here 15% chance of congestive heart failure, around the node all the probabilities add up to 1. So you know that if there is 15% chance of congestive heart failure, then there is 85% chance of not having congestive heart failure. So here I have calculated all the other probabilities that were not shown. Next, we multiply the probabilities of all the events on the same branch. So on the top branch here, we start with a previous MI and congestive heart failure. So the probability of previous MI is 0.25 and the probability of congestive heart failure is 0.15. So the probability of this branch occurring is 0.25 times 0.15, and patients in this branch stay 4.5 days. The expected value is the sum of the product of probabilities and length of stays. So on the top branch, MI and congestive heart failure, the probabilities was 4%, 4 out of 100, and the length of stay was 4.5 days. So we multiply those and we get 0.17. We do this for all the branches and we sum it up, and that's the expected value of. Here is it is the expected stay for Dr. Jones. Again, for each branch, we have the probabilities. We calculate the probabilities of the branch, and we multiply it by the length of stay for that branch. We do this for the second row. We keep doing this for all the branches, and we sum it up, and that gives us the expected length of stay for Dr. Jones. What if Dr. Smith sees Dr. Jones' patients? Then we change the probabilities to reflect the probabilities from Dr. Jones, and we keep the length of stay as Dr. Smith's length of stay for those kinds of patients, and then we multiply them together, and the expected length of stay is 4.26 days. What if Dr. Jones sees Dr. Smith's patients? Again, we do the same thing, and we obtain 3.66 days.